Time Seniors is brought to you by Home Helpers of the Lowcountry, providing safe and independent in-home care. And filmed on location at Riverside at Belfair. More than a retirement community, it's a lifestyle. Welcome to Primetime Seniors, living for today, making choices for tomorrow. I'm Debbie Court, coming to you from Riverside at Belfair, along with our experts, Laura Williams, Executive Director here at Riverside at Belfair, and Debbie Morris, the owner of Home Helpers of the Lowcountry. Happy September.
Happy September.
Back at you.
Where has the year gone? Good Lord in heaven.
August sort of came and went really fast.
And really hot.
Yes, and very hot.
It's been pretty brutal.
Yeah, we had a lot of out-of-town company that we actually went out and had to buy one of the beach cover, the canopies, just so they could stay at the beach. It was so hot. Yeah.
Yep, well, we're moving into fall. We've got a great show lined up for you all. Of course, what we're doing here on Primetime Seniors is really addressing some of the issues that seniors face. And this month's episodes, we're going to be talking about living with memory loss. And there are a lot of different levels of that. And we're going to kind of work our way through the varying is there a progression?
It is.
Right.
It's a progressive loss. Right. Yes.
So it's from maybe some, and what's kind of the normal type of forgetfulness if there is, and when does it become a little bit more of a red flag?
Well, and more difficult to remain in place. Yeah.
And now, Laura, you have some special credentials when it comes to dementia and memory loss. Tell us about that.
I'm one of 3 people in the state of South Carolina that are nationally certified. And so, as a dementia expert, dementia specialist. So it's an additional training annually. We go through extra training and classes and that. It's something that I do just because I feel it's important to give that level of credibility to our families and be able to answer, hopefully, any question that they may have.
Absolutely.
And you have Belfair Gardens, which is a beautiful facility, but that's really dedicated to those with Alzheimer's and dementia.
Absolutely.
Right?
And it's 23, there's 23 apartments and they're all private. I was very much involved with the entire concept and the design.
Because it's new.
It was brand new. It opened in December. It actually filled in 3 months,
wow,
which is very rare. But unfortunately, that also means there was very much a need here in Beaufort County.
Absolutely. So, well, and one of our guests, Karen Dowdy from Memory Matters, took a tour. Right. She's going to be on later this month, and she came back from a tour and just was, as she said, I'm just blown away. I'm breathless. It's so beautiful. So
it is amazing. It's got all those things down the hallway. Just I guess it helps with.
It's the sensory piece of it. Our 5 senses are the closest thing to our memory. And so, whenever you're sitting there and you may hear a song on the radio and it takes you back to something, a day you had at the beach with the kids or something, from your childhood and that. What we did was we designed an entire program that literally is entirely sensory based. Instead of just having pretty pictures on the walls, we did what we call a town square concept, and we did window boxes. So it's like you're window shopping.
But but the residents can take items out and touch them and interact with them.
One of them is a music shop, and we have a real guitar, a real tambourine, real little drumsticks, a real violin. We have a gentleman. God bless him. He did break the first violin when he dropped it, but it's okay. But it's okay. To me, that shows me he's independent. He was trying to do it. I'm fine. You break anything you want. It's okay. It's all about them.
It's interaction.
Absolutely.
Well, and the value of music and the joy of music is a great intro to our first guest this month, which is Janelle Bennick. And she's a music therapist and using music for all kinds of things, including improving your memory or stirring up memories.
There is so much to learn and just a plethora of information. But again, there are so many folks in this area, including yourself and Deb and all the folks that we're going to have on this month that really are great resources for folks. And if you have questions or if you're really not sure how to handle certain things, and we're going to be talking to Dr. Joe Haven also, and really going at it from the caregiver's perspective and some of the stresses that they deal with also, and some of the things that they can do to help improve their wellness. Deb, you at Home Helpers of the Lowcountry now, some of your patients, not all certainly, but you deal with some folks with varying degrees of memory loss.
I would say that probably 75%
Is it
of
that
the
high?
folks that we deal with have some level of dementia or are diagnosed with a cognitive and memory impairment.
Really?
Yeah. And it's just their effort or their family's effort to keep them home as long as they can. But we're always very realistic about when that's not the right choice, and we help them move to another level of care if it's indicated. Yeah.
Right.
And another thing that you know, professionals like Deb and I are faced with is we've got the baby boom generation, and as they enter the retirement years, we're looking, as research has progressed over the years, it's not that there's more dementia out there, it's just being diagnosed more accurately now.
Absolutely.
And so as the baby boomers, you know, come through the generation, the retirement age and that, we're going to see it even more.
Help me understand, because one of my first questions is, what's the difference between dementia and Alzheimer's? Alzheimer's
actually is a group of symptoms. Dementia is the memory loss itself. It is the behaviors that go with it. And what they do is...
so dementia is just one part of Alzheimer's? I didn't mean to interrupt.
It's okay.
I'm sorry.
Alzheimer's is a form of dementia. There are several different types.
It's a specific illness.
Right. There's reversible and irreversible. Sometimes medications can cause dementia. Alcoholism can cause dementia. Those things can be reversible. Okay. Irreversible would be your Lewy body dementia, which is the second highest diagnosed dementia that there is. Alzheimer's being the first and the most frequently, you know, recognizable.
Yeah, my aunt was diagnosed with dementia, but her illness was actually Binswanger's, which is Alzheimer's-like lesions, but they're in a different part of the brain. So it just depends on the illness. But you know, what families, my opinion is, what families need to deal with are the symptoms and getting through that transition and maintaining their life and the quality of life for their loved one who has the memory loss. Truly, at that point, diagnosis is not what matters. It's what's going on day to day.
Right. Wow. Yeah. There's a lot to learn and a lot to cover and a lot coming up here on Primetime Seniors. So stay right there. We'll be right back. Welcome back to Primetime Seniors. Janelle Bennick joins us now. She's with Hospice Care of America, and she's a music therapist, and it is great to have you on the show.
Thank you. I'm so glad to be here.
Yeah, you are, again, a music therapist. How did you get started in that?
Well, what first led me to music therapy is actually the topic of today. I volunteered in a local nursing home in high school, and there were residents there who literally could not speak but could sing. I'll never forget Mary. She was 101 years old, and when I would hold her hands and look in her eyes, she would sing every word of, "Jesus loves me, this I know, for the Bible tells me so." And it was like in that moment that something went off in my brain. Wait a minute, what is it about music that is bringing Mary to speak when the rest of the time she's not interactive with any of the other residents?
Wow. What is it? What is it?
Yes, so what's
music.
the answer?
Well, that led me to explore that further and go on to study at Sam Houston State University and later Immaculata University about how music is processed in the brain, studying music therapy. Music is processed globally in the brain, so speech might be just in one area, but music is activated in all types of centers of the brain. For someone who has a illness such as dementia, Alzheimer's, or any kind of memory impairment, it's accessing areas that we don't always get to with speech. And so, in a sense, it was bringing Mary back to us through the music.
Isn't that remarkable? It really is.
When you think about folks that stutter
And isn't that, but they can sing.
Autistic children, same thing.
Absolutely. And music therapists can be found in many settings. I work in a hospice setting, so my goals are focused on pain and symptom control, family expression, reducement of symptoms such as even breathing, irregular breathing. Music can be used to lower blood pressure and to create memories, new memories, and evoke old ones. It's a sentimental journey, especially with the residents that we see that may be experiencing memory loss.
Wow. I'm sorry, go ahead.
A lot of people don't understand that with any type of dementia, they lose that short-term memory, but they retain that long-term memory.
Right.
And with music, that's what happens. You bring back those long-term memories, and it's just phenomenal.
So that's why at Belfair Gardens you have those...
The different stores.
The different stores that bring back those memories.
And they're totally sensory based, and the music. And she's been wonderful. You had one of our residents that was at Belfair Gardens, and you were just, I will just never forget it. And I'll always be forever thankful. You were phenomenal with Miss Annie. And so it touches your heart, but it also, when you know that someone with dementia, whenever they're getting what they need through music and through the care that you gave, it was just wonderful.
Well, thank you. It can also be used to increase mental functioning, promote meaningful conversation and interaction with their caregivers. Sometimes we don't know what to say, and we don't know how to interact with someone with memory loss. Well, music is a wonderful means to do that. With this resident that we were referring to, she loved sing-alongs, and she would sing, Down by the Old Mill Stream and Let Me Call You Sweetheart at the top of her lungs, and I'll never forget that. It was such a positive way that she could interact with her daughter and also share memories of what it was like growing up in her household.
I had a question for you, Janelle, too, that, for folks that are maybe transitioning into a facility or into a new apartment, or even for folks who are staying home, like the folks that we work with, how do we use music to create a more beneficial environment for them? We have an example that comes to mind is we have a gentleman up in the northern part of Beaufort County who's very agitated and can get a little aggressive. How could his family and staff work with him using music to calm him?
Well, that's an excellent question. And first, I would ask another question. What is his preference music? What music did he really enjoy when he was in his prime? I always, when I make a music therapy assessment, go back to that. Did they sing? Did they play instruments growing up? Everyone has a preference in music, just like we have preferences in food. So I would use his preference music, especially at the times that might be a little difficult for him, sometimes during a transitional time, transitioning to go to bed or to go to a meal. And use it as a motivation too. It's a way, we can sit and listen. Perhaps you can sing along, or even if you have access to a small instrument like a small drum or shaker, just as a way for him to become more involved in the music and engage.
So not necessarily playing soft, soothing music. That may not be the answer for everybody.
No.
It could be he wants to hear saxophone and jazz.
Exactly. And that's kind of a common misconception, is that as a music therapist I'm going to impose, or we need to bring a certain kind of music. The right kind of music is the right kind of music for you, and it's based on every individual. It is what is the music that you feel most comfortable with. That's not to say that the use of a relaxation music could be still used, especially if maybe you're working on sleep or something like that, and you want something that would naturally slow down the heart rate and match, with the patient's breathing and such, so that they become more relaxed to the state of the music.
Yeah. Well, think about it in our own homes. I mean, I love when I'm in the kitchen and doing a lot of cooking stuff to have the association playing and songs that I remember from younger days, just going and
Skaggs
that's my Skaggs is my guy, but that's what it's a great point, because I think that naturally we would think we needed to create the environment based on our values and what we think would work. And I think the idea of being focused on the person and being person-centered on the choices is key.
It's amazing too, like if you're even flipping through Sirius radio in my car, and you hit the different decades,
right? And
sometimes a song will come on that will trigger a bad memory, and wow, what that does to you emotionally! It's like you can't change it fast enough. So it is amazing that on the good and the negative side of things, the effect that that music has and how it does bring up those memories.
You're really hitting on a strong point, is that it does elicit both, the psychological. It can alter mood, but it also has, physical implications. So music affects our whole bodies. If you think about what our bodies are mostly made of, is water, and water resonates sound. So our whole bodies will respond to music.
Speaking of music.
There we go.
So take us through what you would do with a patient. Just like maybe a little condensed version of a music therapy session.
Absolutely. Well, first I would have made an assessment to see if they would be appropriate for a music therapy service. While I would love everyone to have music therapy, it may not be the right cup of tea for that person. So assessing their music tastes and interests and backgrounds, as well as what is my main goal. Music therapy is very goal-oriented. Is it that we are working on a symptom of depression, or pain, or anxiety? And so I would tailor my interventions based on that individual and on their individual needs. We would probably use some kind of preference music, and it would depend on what the person needs, but whether that's sing-along. I do a lot of sing-along of those preference songs. Instrument play, I've been known to pull out a drum or two and get the person engaged. As well as listening. I've found with one particular resident that has a little bit of dementia, she really enjoys classical music. And so we use music listening along with a themed story, and then she can use her imagination to express what her journey is when she's listening through the music.
Right.
That's an adaptive style of what's called guided imagery in music. She finds that very relaxing, and it helps bring about a lot of realizations as she's working through her depression.
That's great. Well, as we wrap things up, take us out with a little...
Oh, yeah.
Yes.
Take us out with a little song here.
It's all about our sentimental journey. Gonna take a sentimental journey, gonna set my heart at ease, gonna make a sentimental journey to renew old memories. Got my bag, I got my reservation, spend each time I could afford, like a child in wild anticipation, long to hear that all aboard. 7, that's the time we leave at 7.
We'll be right back here on Primetime Senior.
I'll be waiting up for heaven.
Welcome back to Primetime Seniors. We're coming to you now from Main Street Health Center here on Hilton Head. And I am joined by Dr. Joseph Haven, one of the chiropractors here. Great to see you.
Good to see you.
This month we are talking about living with memory loss. And we thought with you all, we really wanted to focus on the caregivers, because they are in a day-to-day stressful situation, and those stresses that they experience can start to manifest themselves physically. So knowing that you all are here to help with different physical symptoms and a multitude of things that people might experience, we thought we would pay a little attention to the caregivers, who are such an important part of the patient care and providing that to the patients on a daily basis. So let's talk about maybe some of the stresses that they would experience, and then some of the physical symptoms that they would experience as well.
Great. Well, caregivers, particularly family members and close friends, can really suffer from a wide range of symptoms and problems resulting from the stress of the situation. And it's probably best to first kind of define stress. Stress is really neither good nor bad. Too much stress is really what the problem is. If you don't stress your muscles physically, then you get muscle atrophy. If you don't stress your mind, use your mind, it kind of turns to mush.
Those are good things. Yeah, okay.
So stress really, we need to kind of redefine it. It's really about balance and not having too much. But the problem and what people generally perceive as stress is excessive emotional stress. Really, there's three types of stress. There's the emotional, physical, and chemical stress, like we just mentioned with the too much. If I asked you to run a marathon, a 20-mile marathon, that would be too much of a physical stress for you.
Stress, yes.
If I had you drink 5 cups of coffee this morning, that may be a chemical stress that would be too much for you. But 1 cup may actually help you or be beneficial.
Balance.
So it's about balance and it's about excess. But even though our practice here at Main Street Health Center primarily focuses on musculoskeletal conditions, we do treat many other conditions, particularly with our medical doctor being a general practitioner, Dr. Bobby Ayers. He obviously treats all kinds of conditions. And our acupuncturist, Abby Peters, with her discipline of acupuncture, can treat virtually all conditions. And certainly those conditions that fall outside the physical end of things can certainly be helped by those two disciplines.
So the caregivers, again, like you said, they would be under maybe some physical stress due to, with some patients we talked earlier in the show about there being variances of memory loss. So those that may be struggling a little bit more may need more physical assistance. So they actually could have some stresses in their body that would affect more of the muscular skeletal areas, the back and neck and such. And then they could also have the emotional stresses and chemical stresses. Would that be, well, no, that would be more emotional, like just being in that situation.
Well, they all, and what I always explain to patients is we look at our triangle of health. And in that triangle of health, we have emotions, we have the body chemistry, and we have physical end of things. And I can just give you a quick example. If you get a phone call in the middle of the night and you're woken from a sound sleep, that's not a physical stress, it's not a chemical stress, it would be an emotional stress.
Oh, okay. Yeah.
Yet you get woken up, you sit up in bed, your heart's pounding, your eyes are dilating, the blood's flowing to you're getting all this adrenaline rush, which that emotional stress has created a chemical reaction in your body, the adrenaline, that then creates physical changes in your body. So one affects the other. So it's very hard to just clearly say this is just an emotional problem or just a physical problem or just a chemical problem. They're really all intertwined.
And as always, with any of the patients that come in, you give them a thorough assessment and then you come up with the integrated wellness plan that best
suits their condition.
Okay. And it's important, too, before we close, we want to talk about the importance of proactive wellness. And a lot of patients probably come in with the hurts and the symptoms and all of that. And we're all guilty of that, is waiting until there's really an issue that's flared up.
Well,
but you can do things to be more proactive, right?
And unfortunately, most patients do come in because they have a problem. While they're here and while we're treating them, one of our main goals is to educate them on what they can do to prevent this from happening again. And it's all about maintenance. You don't wait for your car to break down to bring it to the mechanic. You maintain it, you take care of it. And it's really the same thing with the body. Unfortunately, in this country, we're kind of programmed to wait until there's a problem. So that is one of the things we try to get our patients, as we've addressed their issues, to get them to understand what can they do from a chiropractic standpoint, medical standpoint, acupuncture standpoint,
massage
to maintain. Exactly.
That's great, and both for the caregiver and the patient as well, because as that patient is dealing with their issues, it's important to maintain their best wellness as well. So thank you so much, Dr. Haven. It's so much to learn. Again, it's just been very enlightening. We want to thank you for watching this episode of Primetime Seniors. As always, we encourage you to live Primetime Seniors.